Hi there, I'm Dr. Karyn. One of the more common things I get asked about in practice is about vaccinating cats. Is it safe? Is it necessary? What are the dangers and side effects? So today I'm going to share with you the truth about cat vaccinations. So one of the major risks of vaccinating cats in particular is something you may or may not have heard of called an injection site sarcoma, which is a fairly nasty type of tumour that can develop in the location where cats have been given an injection, particularly a vaccination. It is something that as owners we should be aware of, but it's not the whole story. So I'd like to talk to you all about that, but in order to do that, I need to give you a little bit more of a background as to where vaccination really came from, how it works, and where vaccination site sarcomas actually fit into that big picture. So vaccination really started with humans, and this practice of exposing humans and then later animals to a small or somewhat controlled dose of an infectious agent to trigger an immune response actually dates back to at least the mid-15th century, possibly even earlier. The time when vaccination really got going was when smallpox was busy wiping out hundreds of millions of people around the world. And using a process that they called variolation, they started to inject a small amount of the discharge from a smallpox lesion into a healthy human. And this was obviously quite a risky procedure because there was always a high chance that they would develop sort of a full case of smallpox, which was invariably fatal. But it did start to prove that by triggering an immune response to a small dose of virus, it could actually render the patient immune. It wasn't until a man named Dr. Edward Jenner, no, not those ones. Honestly, you can't go anywhere without hearing about bloody Jenners these days. He discovered that the same immune response to the smallpox virus could be achieved by using a related but safer pox virus, which was cowpox. So how does this whole vaccination system work? When a virus enters the body, it triggers the immune system to release these pathogen-fighting cells like neutrophils, monocytes, and lymphocytes, which you might sometimes hear referred to as T cells or B cells. And after a while, the body starts producing these T cells and B cells that can more specifically target the viral particles. And that results in a much stronger, faster attack of the virus. If that virus is successfully eliminated, the bone marrow sort of keeps a memory of that virus, and it keeps producing these memory T cells and memory B cells. And they can last for months, years, sometimes even a lifetime, depending on the virus and the individual. So that means that if the bodies were to encounter that virus again, it would immediately jump to that quicker, more targeted immune reaction. So the problem with just relying on our natural immune response to a virus is that it's kind of a game of chance. We only develop a natural immunity to an infection if we survive that infection. And even if we do survive, we might end up with some long-term or permanent health consequences from the infection itself. So this is where vaccination comes in. So a vaccine uses a deactivated version of a virus to sort of trick the immune system into producing that similar immune reaction, creating those memory cells without causing the actual full-on infection. So because we're triggering the immune response, that usually results in a patient feeling unwell or even sometimes showing some mild symptoms of the virus, but this is simply a sign that the immune system is responding. So here's where it gets a little bit more technical. In order to trigger a good enough response to the inactivated virus, Most vaccines use something called an adjuvant. And what this essentially does is it really kind of fires up the immune system, making sure it gets to that stage of making the memory cells. And it's often the body's response to this adjuvant that creates the majority of the side effects we tend to see. But the more powerfully the body reacts to a vaccination, the more likely it is that we've created a good supply of memory cells. So the next time we do encounter that virus, we fight it off more quickly, more efficiently. So how does this all fit in with our cats? Just like with humans, cats do often suffer from the side effects of vaccination, including lethargy, fever, or swelling around the injection site. And it might be unpleasant for a day or two, but it's an expected reaction. A true adverse reaction to a vaccine, where we might get like an allergic reaction or a full systemic reaction, these are actually really, really rare. The most worrying potential side effect to vaccination in cats is this thing called an injection site sarcoma. And this is a malignant tumor that can form where a vaccination has been given. It's a nasty tumour and it requires aggressive treatment, including surgical removal of the tumour itself. As you probably know, feline vaccines are usually given in the scruff because there's a lot of loose skin in this area. It's much easier to inject, it's much more comfortable, and it's much less stressful for the cat. But if an injection site sarcoma was to develop in this location, we're dealing with a site that's directly over the spine. So that makes it really difficult, if not impossible, to remove the tumour if one grows in this area. So to try to combat this risk, it has been recommended that cats be vaccinated over a limb, because this means worst case scenario, if a tumour were to develop, we could amputate a limb to basically eradicate that tumour. Obviously, the lower down a limb you move, the less loose skin there is, the less tissue there is, and you're much more likely to cause a lot of local reaction, pain, discomfort, and stress. And it's, it is a difficult location to try and vaccinate a cat. So sometimes it becomes a bit of a case of weighing up the risks and benefits, as well as finding other ways to reduce the risks of injection. Studies have found that feline leukemia virus vaccine appears to have a higher risk of inducing sarcoma, though they're not entirely sure why. But it may be due to the fact that the feline leukemia virus itself attacks bone marrow and really affects the immune system. So one of the ways that we try to minimize the risk of injection site sarcoma in this situation is by only giving the leukemia vaccine every 3 years rather than annually. One company has created a non-adjuvanted vaccine in the hopes that this will result in less intense side effects. But this vaccine doesn't give as long-lasting protection as ones that contain the adjuvant, so it's then needed to be given annually. Risk assessment is another way we can reduce our cats' risks. So cats that are in large groups, breeding colonies, in shelter environments, that live outdoors, or if you have cats sort of regularly coming and going, perhaps you foster cats or that kind of situation, they have a much greater risk of interacting with cats that could be infected with feline leukemia virus. So realistically, the risks of them getting the virus far outweigh the low risk of them developing an injection site sarcoma. So really, these cats should be vaccinated against leukemia virus according to the manufacturer recommendation. For cats living indoors, like my own cats, once they have received a complete primary vaccination course, and I tend to recommend that being the full kitten program of vaccinations plus a booster 1 year later, you may want to talk to your vet about whether or not they need to continue with this particular vaccine. While viruses like cat flu can be transmitted through the air and on surfaces, so I can actually bring that virus home on my clothing and give that to the cats. Plus, this is a virus that mutates year to year. So keeping our cat protected against those viruses, even if they don't leave the house, is really important. Leukemia virus requires direct cat-to-cat contact to spread. So you may decide that if your cat has very, very little or no risk of contacting a cat that could be infected, then you may decide to not continue vaccination or vaccinate against leukemia less frequently. That is something for you to discuss with your vet, and it is something for you to decide as well. If you do decide to go down the route of non-vaccination against leukemia virus, as I said, it's still important to keep on with vaccinations against things like cat flu, rabies, obviously. And you need to make sure that if you do introduce any new cats into your home, that they have had a complete vaccination course and have been tested for the virus before coming into contact with your cat. So you might be asking, why use this vaccine at all if there is a risk of it causing a tumour? Well, when a cat becomes infected with feline leukemia virus, there's a window of time where if the virus is successfully eliminated, the cat will survive and have gained natural immunity. Yay! However, we don't know how long that immunity lasts. And if the virus is not eliminated within that window of time, the cat will develop feline leukemia, which is a debilitating disease that often leads to suffering and death. So you might ask, are vaccines safe? Of course not. We are manipulating the immune system with an artificially altered version of a virus. Does that sound safe to you? But it's a hell of a lot safer than taking our chances of surviving the actual virus. So here's a few statistics to be aware of. Around 3% of cats in the United States and Canada are infected with feline leukemia. And feline leukemia virus is fatal in 80 to 90% of cases. The incidence of injection site sarcoma is between 1 in 1,000 and 1 in 30,000 cases. The fact is, if we're putting something into the body to elicit a reaction, side effects are inevitable. If a drug or a vaccine claims to have 0 side effects, it probably doesn't have any actual effects either. I completely agree that we're in a society where big pharmaceutical companies profit from disease. And I think that we're right to do our own research and ask questions. But the fact that big pharma makes money from vaccination does not mean that vaccination is bad. Is it really crappy that people out there stand to make billions from every viral outbreak? Yeah, absolutely. But that shouldn't mean that we stop protecting our pets. Natural immunity might work, but it only works if our cat survives the virus. So thanks for listening, and I hope that answers some of your questions about vaccinating our cats, the risks that are involved in vaccinating our cats, and why a lot of the times those risks are worth taking.